Get out of my OR now! Dr. Robert Hayes slammed his clipboard down so hard the metal edge cracked against the counter and every head in the trauma bay snapped toward him. He was pointing not at a problem, not at a machine. He was pointing at Clara Bennett, a nurse who had just quietly flagged a reading on the monitor that nobody else had caught. His voice didn't lower. It never did. I don't need a floor nurse second-guessing my decisions in front of my patient. You are here to follow orders, not think. Clara said nothing. She simply stepped back, folded her hands and looked at the floor. The room exhaled. But something in that silence, something in the way she stood was not surrender. It was patience. And patience, as they say, is the deadliest weapon of all. If this story moves you, please subscribe to our channel, hit that notification bell, and drop the name of your city in the comments below. I want to see just how far this story travels. Now let's begin. The first thing most people noticed about Clara Bennett was that she never raised her voice. In a military hospital where voices were constantly raised, where the air itself seemed to vibrate with urgency, with ego, with the particular brand of pressure that comes from treating bodies broken by war, Clara's quiet was almost disorienting. She moved through the corridors of Walter Reed Military Medical Center the way water moves around the stone, efficient, deliberate, unobtrusive. She had been there 4 months. 4 months of 12-hour shifts of charts, meticulously updated of medications drawn up with the kind of precision that other nurses noticed but rarely commented on. 4 months of being called the new girl by people who had stopped being new themselves years ago and had mistaken familiarity for wisdom. She was 34 years old. She looked younger. She spoke softly, wore her dark hair pulled back tight, and had a habit of watching, really watching, the kind of watching that made some people uneasy without knowing exactly why. Nobody knew what she had done before this. That was the way Clara wanted it. It was a Tuesday in November when the night shift started and the world began to tip off its axis in ways Clara had already learned to recognize. The hospital was busy. It was always busy, but there was a particular quality to the noise that evening. A compressed electricity in the hallways, the kind that precedes something no one has planned for. She was 2 hours into her shift working the trauma recovery ward when she overheard 2 orderlies near the elevator. "Inbound from Andrews," one of them said, keeping his voice low in the way people do when the information feels too large for casual delivery. "SEAL team, covert op. They're not saying where." The other one shook his head. "How bad? Bad enough." Clara continued walking. She made a notation on the chart in her hands. She did not react, but something in her chest, something she had spent a long time learning to keep very still, shifted just slightly. 20 minutes later, the trauma bay doors blew open. Sergeant Mark Carter arrived on a gurney surrounded by 4 people, moving fast, calling out numbers, their voices precise and layered the way trauma arrivals always were. Each person managing their own stream of information while simultaneously absorbing everyone else's. He was big, even flat on his back, even unconscious. You could see the density of him, the kind of physical architecture that takes years of discipline to build. He had blood on his neck and his left side and an oxygen mask over his face, and his vitals, according to the paramedic reading them off, were holding barely. Dr. Robert Hayes walked into the trauma bay the way he always walked into rooms, like the room had been waiting for him. He was 51, silver-haired, built like a former athlete who had traded the gym for long dinners and considered it an upgrade. He had a wall of commendations in his office. He had a way of speaking to nurses that wasn't exactly cruel, not in a documentable way, but that carried always the implicit message that their function was execution, not thought. He gave the orders. They carried them out. That was the natural hierarchy of things as far as he was concerned, and anyone who didn't understand that simply hadn't been here long enough. Clara had been assigned to the trauma bay for the evening as backup coverage. When Hayes walked in and saw her, his expression didn't change. She was part of the furniture. "Bennett," he said, not looking at her, "prep the secondary line and stay out of the way." "Yes, doctor." She moved to the supply cart. She prepped the line. She stayed technically out of the way, but she was watching Mark Carter. She had been watching him since the moment the gurney came through the door, and she saw something in the pattern of his breathing and the color at the base of his neck, in the way his left hand had curled slightly inward, was scratching at the back of her mind with quiet insistence. Hayes was directing the team through the standard protocol, calling out instructions in the clipped, authoritative cadence that filled residents with automatic deference. Two nurses moved around the bed. A respiratory tech adjusted equipment. The trauma fellow Dr. Yolanda Reyes was at Hayes's elbow, watching, listening, occasionally offering a quiet observation that Hayes would either incorporate or dismiss based on some internal calculus that had little to do with its merit. Clara kept her hands busy and her eyes on the patient. The oxygen saturation number dropped 1 point, then held, then dropped again. She checked the waveform on the monitor. Something about its shape was wrong. Not catastrophically wrong, not yet, but wrong in a way that was specific, that spoke a language she had learned in places she no longer talked about. "Dr. Hayes," she said. He did not look up. Not now. His SAT is dropping and the waveform on his pulse ox looks. "I said not now, Bennett." This time he did look up just long enough to make the dismissal complete. "I'm aware of the numbers. Do your job." She went quiet. She looked at the monitor again. The number held at 92, then 91. Dr. Reyes glanced at Clara. It was a brief glance, non-committal, the kind that acknowledges something without taking a side. Clara moved closer to the head of the bed. She wasn't in anyone's way. She was simply repositioning herself the way nurses do, the kind of movement that looks administrative from the outside. She checked the rise of his chest. She checked the angle of his neck. She checked the position of the oxygen mask. And then she saw it, not the problem itself yet, but the shadow of it, the particular configuration of signs that in her experience meant the problem was already happening and hadn't announced itself loudly enough for the people looking at the big picture to notice. "Dr. Hayes, I think there may be a tension component building on the left side. His trachea." "Clara." He used her first name the way some people use a blade. Quiet, precise, designed to cut. "You are a floor nurse covering trauma backup. I have been a trauma surgeon for 22 years. I have the imaging, I have the vitals, and I am managing this patient. What I need from you is silence and compliance. Can you provide that?" The room was still. The respiratory tech looked at the ceiling. One of the other nurses found something to do on the far side of the cart. Dr. Reyes was very still. Clara looked at Dr. Hayes. Then she looked at Mark Carter. Then she looked at the monitor. 89. "Doctor," she said, and her voice had changed, not louder, not angry, but different in a way that was hard to immediately categorize. "His oxygen saturation is at 89 and dropping. The deviation in the waveform, the tracheal shift, and the decreased breath sounds on the left. I think he's developing a tension pneumothorax." Hayes set down the instrument in his hand. He straightened up. He looked at her the way a teacher looks at a student who has just said something embarrassing in front of the whole class. "That's not what this is." "I think it might be." "I don't care what you think." His heart rate just jumped to 138. Hayes looked at the monitor. His jaw tightened fractionally. "That's a stress response to the procedure, nothing more. Bennett, I'm going to ask you one more time to..." The monitor alarm went off. It was not a subtle sound. It was the kind of sound that stopped time, that reorganized the hierarchy of everything happening in a room instantaneously. 85, 83. Mark Carter's blood pressure began to fall. His heart rate paradoxically spiked, then began to fluctuate with a pattern that meant the heart was working against something it couldn't overcome. "BP dropping," called the nurse at the monitor. "Systolic 78. Hayes moved fast. He was good at moving fast, whatever else he was, and he began calling out adjustments. But his voice had a slightly different quality now, and Clara recognized it. It was the voice of someone recalibrating, someone who had been certain and was now privately, furiously becoming less certain. Clara did not wait. She moved to the left side of the bed. She had already identified what she needed. Her hands were already moving. "Bennett," Hayes's voice cracked like a whip. Step back right now." "What are you..." "He's going to arrest in under 2 minutes, Clara said. Her voice was completely calm, not defiant, not emotional, simply factual, the way a flight instrument is factual. "There is air accumulating in his left pleural space, and it is shifting his mediastinum. If we don't decompress it right now, we lose him. You are not a physician. You do not perform. I know exactly what I am." And then she did it. It took seconds. The technique was clean, practiced, executed with the kind of muscle memory that doesn't come from textbooks. She used what was available, she used her training, and she did what needed to be done. And when it was done, the monitor that had been screaming its alarm into the cold air of the trauma bay, began slowly to change its tone. 88, 90, 93. The blood pressure began to come back. Mark Carter's chest rose in a full, even breath, the first full breath in nearly 4 minutes. The room was silent in a way it had not been since the gurney came through the door. Clara stepped back. She placed the instruments on the tray. She straightened her gloves. Hayes was standing very still. His face was doing something complicated, cycling through several expressions that didn't quite reach the surface, each one suppressed before it could fully form. Dr. Reyes was staring at Clara with an expression that was equal parts stunned and something else, something that looked quietly like recognition. Saturation coming up, the monitor nurse said, her voice smaller than before. 96, 97. Hayes finally spoke. Get imaging on that left field. His voice was controlled, professional, the voice he used in front of other surgeons. And someone page cardio. He did not look at Clara. Bennett, my office, when this is stable. Yes, doctor. She didn't move from the bedside, he noticed. Bennett, when he's stable, she said quietly, and there was something in her tone that was not insubordination. It was something older and quieter than insubordination. It was the voice of someone who had already decided which things mattered and was simply acting accordingly. Hayes left the room. Clara remained with Mark Carter, checking his vitals, adjusting the oxygen flow, watching the numbers with the focused patience of someone who had once watched much smaller numbers for much longer in places where the consequences of inattention were permanent. 2 hours later, Mark Carter's vitals were holding. The imaging confirmed what Clara had said. Tension pneumothorax left side exactly as described. Now resolved. The cardiology consult agreed. The trauma fellow wrote it in the notes with the careful language doctors use when they are documenting something that contains between its lines an uncomfortable amount of information. Clara was at the nursing station updating her charts when she heard the first shift nurses beginning to arrive. The corridor noise shifted from the hushed tension of overnight to the slightly brighter pitch of morning handover. Somewhere down the hall, a cartwheel squeaked on the tile. A hand touched her arm. She looked up. It was Janet Morse, a veteran night nurse who had been at the hospital for 11 years and who had the particular quality of trustworthiness that comes not from warmth alone, but from having been tested and not found wanting. You okay? Janet asked. Fine. Hayes is going to come for you. I know. What you did in there was what needed to be done. Janet looked at her for a long moment. Clara, where did you learn to do that? Clara looked down at her chart. The cursor blinked on the screen in front of her. I've seen it before, she said simply. Janet didn't push it. She had enough experience to know when a door was closed. It was just after 7 in the morning when the call came from recovery. Mark Carter was awake. He was asking for water and for someone to turn down the overhead light, and according to the recovery nurse who called, he was being, quote, politely difficult, which in hospital shorthand generally meant the patient was functional and unhappy about being in the hospital, which was considered a positive sign. Clara was not assigned to recovery. She had no professional reason to go. She went anyway. She stood at the door of his room for a moment before she entered. He was propped up, slightly pale, with the particular hollowed-out look of someone whose body had been through something serious and was now doing the hard and glorious work of rebuilding. His eyes were open and tracking. They found her the moment she came through the door. You're the one, he said. His voice was rough from the tube. I'm one of the nurses from last night, she said. I wanted to check in. He looked at her, not the way most patients looked at nurses, not with the mild, grateful half-attention of someone being cared for, but with the deliberate, systematic attention of someone who was assessing. She recognized the look. She had worn it herself in a different life. The doctor, the one who was running the room, Mark said. He wasn't going to do it. Dr. Hayes made the right calls throughout your treatment, Clara said carefully. Mark's mouth did something that was almost a smile. You're diplomatic. I'm a nurse. Right. He shifted slightly, and she saw the effort it cost him, and she moved to adjust his pillow without being asked, and for a moment they were simply two people in a hospital room and the world outside it didn't exist. Then he said quietly, Where did you serve? She went still. Excuse me? The decompression, the technique, The way you moved in that room. He paused. The way you're standing right now. Another pause. Where did you serve? Clara looked at him. The morning light came through the blinds in clean parallel lines. I'm a nurse, she said again. Yeah, said Mark Carter. So am I technically. Combat medic, special operations. We're all nurses when it counts. He looked at her steadily. But that's not what you were. The silence lasted about 4 seconds. Clara said, you should rest. You should answer the question. You need to rest. You need to stop deflecting. She reached for his chart at the foot of the bed. She made a note. Her handwriting was even and unhurried. Is there anything you need? She asked. Water, pain management, call for anything. She started for the door. Hey. His voice was quiet, but it carried. She stopped. Thank you, he said. For last night, I know what you did. She didn't turn around. You're welcome, Sergeant. She walked out into the hallway and pulled the door gently shut behind her. The hallway noise closed around her wheels and voices in the overhead PA and the everyday mechanical symphony of a working hospital, and she stood in it for a moment, breathing evenly, her face giving nothing away. Down the hall, she could see Dr. Hayes walking toward her. He had 2 administrators with him. His expression was the one he wore when he was managing a situation professional, composed, and underneath it, running hot. Clara straightened. She tucked the chart under her arm. She waited. Hayes stopped 3 feet in front of her. The 2 administrators, a man named Gerald Holt from hospital administration and a woman named Dr. Patricia Sims, the chief of nursing, stopped just behind him. Bennett, Hayes said, I think we need to have a conversation. Of course, doctor. What you did last night was unauthorized, reckless, and a direct violation of the scope of nursing practice as defined by, it saved his life, Clara said. Hayes's expression flickered. That is not the point. That seems like it should be the point. The point, Hayes said, his voice dropping in a way that was more threatening than a shout, is that you operated outside your authority. You performed a medical procedure without physician direction. You could have killed that patient. You could have killed him with your... He was going to die without it, Clara said. His oxygen saturation was at 83 and falling. His mediastinum was shifted. His heart rate was deteriorating. The imaging confirmed tension pneumothorax left side. I made the assessment and I acted on it. The patient is alive. You are a nurse, Hayes said, and the word came out the way it always did with him, precise, categorical, a box with walls. You are not a physician. You do not make those calls. With respect, doctor, someone has to make them when they need to be made. Dr. Sims spoke for the first time. Her voice was measured in the voice of someone who had learned to be very careful in complicated situations. Clara, we're going to need to discuss this formally. There are protocols. I understand, Clara said. Your actions, while the outcome was positive, raised serious questions about the chain of... I understand, Clara said again. Hayes crossed his arms. I want her off the trauma rotation, effective immediately. A door opened. It was Mark Carter's room. He was standing in the doorway. He should not have been standing, and the recovery nurse trailing behind him was making that clear in a rising voice, and he was holding his IV pole like a walking stick, and his face was set with the expression of someone who has decided that a thing is going to happen, and the details are secondary. Dr. Hayes, he said. Hayes turned. Whatever he had expected to see, it wasn't this. Sergeant Carter, you need to be in bed. I've been in worse positions, Mark said. I'm fine. He looked at Hayes with the flat level attention of someone who has spent a significant portion of his professional life making threat assessments. I want to know why the person who saved my life is standing in a hallway getting lectured. Hayes's jaw tightened. Sergeant, this is an internal hospital matter, and it became my matter when I stopped breathing. Mark looked at Clara, then he looked back at Hayes. Then in a voice that was completely quiet and completely clear, he said, she knew what was wrong when nobody else did. She told you. You didn't listen. She did what needed doing, and I am alive. That's the whole story. How does the rest of it go from there? The silence had weight. Hayes opened his mouth. Don't, said Mark Carter, and there was something in the word, a single syllable, not loud, not angry, that was simply so certain of itself that Hayes closed his mouth again. Dr. Sims cleared her throat. We should all take this into a conference room. Agreed, said Clara. Fine, said Hayes. Mark Carter looked at Clara one more time, and then very quietly, before the recovery nurse guided him back through his door, he said 6 words that would by the end of the week change everything. Thank you, Seal, I owe you. The hallway froze. Hayes stared at Mark, then at Clara, then at Mark again. Dr. Sims had gone very still. Clara looked straight ahead, her expression giving nothing away. The same even unhurried face she always wore, but something had shifted in the air of the corridor, something that couldn't be unshifted, a door that had been closed for 4 months, standing suddenly irreversibly open. He needs to rest, Clara said quietly to no one in particular, and she walked toward the conference room ahead of all of them, her footsteps even and unhurried on the tile. Behind her, she could hear Hayes's breathing. She could hear Dr. Sims saying something low to Gerald Holt. She could hear the ordinary sounds of the hospital going about its morning, indifferent to the fact that something had just broken open in a hallway. And nothing, not for Clara Bennett, not for Dr. Robert Hayes, not for the institution that employed them both, would look quite the same on the other side of it. She pushed the conference room door open. She sat down. She folded her hands on the table. And she waited with exactly the same patience she had always waited with for the rest of the story to catch up. The conference room had a long table and 8 chairs and a window that nobody looked out of. Clara sat at one end. Dr. Hayes sat at the other. Between them, Dr. Patricia Sims and Gerald Holt arranged themselves with the careful neutrality of people who understood they were sitting in the middle of something they hadn't been warned about. A legal affairs representative named Dennis Farrow had been called in. He arrived 4 minutes late, slightly out of breath with a yellow legal pad and the expression of a man who had been hoping for a quiet Tuesday. Nobody offered coffee. Hayes spoke first. He always spoke first. It was one of the constants of his professional universe. The same way gravity was constant, reliable, inevitable, and not something anyone had ever thought to question. I want the record to reflect, he said, that what occurred in that trauma bay last night was a clear and documented breach of nursing scope of practice, that it was performed without physician direction, without proper sterilization protocol, verification, and without the informed consent of the medical team overseeing the patient's care. He was looking at Dennis Farrow when he said it, not at Clara. That was deliberate. It was a courtroom technique applied to a conference room, the verbal equivalent of building a wall before the other side could speak. Dennis Farrow wrote something on his legal pad. Dr. Sims said, "Clara, I want to give you the opportunity to speak to what happened." "Thank you," Clara said. She didn't rush. She had learned in another life that the person who rushes in a tense room usually loses the room. At approximately 11:47 p.m. I observed Sergeant Carter's pulse oximetry waveform demonstrating a pattern inconsistent with simple respiratory compromise. His oxygen saturation had fallen to 83% and was trending downward. I noted tracheal deviation to the right, decreased breath sounds on the left, and rising jugular venous pressure. I communicated my concern to Dr. Hayes twice. On both occasions, he directed me to be silent. "That is a mischaracterization," Hayes began. "I have not interrupted you," Clara said. Her voice was pleasant. Her eyes were not. Hayes stopped. Sims said, "Go ahead, Clara." When the monitor alarm triggered and the patient began to decompensate, I made the assessment that intervention could not wait for physician direction without the patient dying. I performed a needle decompression. His saturation recovered to 97 within approximately 90 seconds. The subsequent imaging confirmed left-sided tension pneumothorax. The procedure was the correct one. She paused. "I understand there are questions about my authority to act. I would like the record to also reflect that the patient is alive." Silence. Hayes's expression had been moving through several iterations of controlled fury, and he finally landed on something that looked like cold professional disdain, which was the most dangerous version of him because it was the version that made decisions that lasted. "The question of the patient's current status," he said, "does not retroactively legitimize an unauthorized procedure. Nurses do not perform needle decompressions. That is not a gray area. That is not a matter of interpretation. It is a clearly defined boundary of—" "Where did you train?" Holt asked Clara suddenly. The question dropped into the room sideways. Everyone looked at him. He was leaning forward, elbows on the table, and his expression was not the carefully managed administrative neutrality it had been 60 seconds earlier. It was something more direct. Nursing school, Clara said, before that. I'm not sure that's relevant to Sergeant Carter called you a SEAL, Holt said, in a hospital hallway, in front of 3 administrative staff members. I'd say it's fairly relevant. The room temperature changed. Hayes looked at Holt, then at Clara. Something moved behind his eyes, not quite recognition, not yet, but the beginning of a recalculation that he very much did not want to make. I'm not here to discuss my personal history, Clara said. Clara, doctor. Sim's voice was gentle, but it had a spine to it. Sergeant Carter is a credentialed SEAL operator. He's been in enough medical situations to know what he's looking at. When he uses a specific word to identify someone, it's not casual. If you have a background that's relevant to what happened last night, it would be better for everyone, including you, if that background was on the table. Clara looked at the window. The morning light was very still. I served, she said. Navy, Holt asked. Yes. How long? 9 years. Hayes made a sound. It was not quite a word. It was the sound of someone whose internal model of a situation is being revised against their will. What was your role? Sims asked. Clara looked at her hands for a moment. Then she looked up. Special Operations Combat Medic, Naval Special Warfare, 3 deployments. The silence this time was different from the previous silences. It had a different texture. It was the silence of people sitting with information and not yet knowing what shape it made. Dennis Farrow had stopped writing. Hayes said very quietly, "You're telling me you were a SEAL." "I'm telling you I served in Naval Special Warfare in a combat medic capacity," Clara said carefully. "The specifics of my role are not something I'm at liberty to detail. What I can tell you is that I have performed emergency needle decompression in the field under combat conditions. I know the procedure. I know the presentation. I knew what was happening to Sergeant Carter before the monitor told you." Hayes was very still. It was a different kind of stillness than his usual self-possession. This was the stillness of a man standing at the edge of something and not entirely in control of what happened next. "Why, bye," he said slowly. "Are you working as a floor nurse?" It was the first time he had asked her a question that didn't have an implicit insult inside it. "Because I wanted to," Clara said. He stared at her. He didn't understand it. She could see that he didn't understand it, and she felt briefly the quiet exhaustion of knowing that the understanding would not come quickly and was not her responsibility to provide. "This doesn't change the procedural issue," he said finally, and his voice had lost some of its certainty but none of its stubbornness. "The hospital has policies. The policies exist for reasons. If everyone decided to act on their own judgment the moment they felt confident enough, people would die less often," Clara said. The words landed flat and clean, and Hayes couldn't find an immediate answer to them. Sim stepped in. "We're going to need to take some time with us, Clara Baum. I want you to know that this committee will approach the review with fairness and with a complete picture. I'd also ask that what was discussed here remain in this room for now." "Of course," Clara said. "Hayes," Sims looked at him, "I want the same from you." "Naturally," he said. But the word came out slightly too fast, and Clara noticed it, and she thought not for the first time that the things people say naturally were often the things they had the least intention of honoring. She left the conference room first. She walked back toward the nursing station, collected her remaining charts, and finished the last 90 minutes of her shift with the same methodical steadiness that had characterized the previous 10 hours. She said good morning to the incoming nurses. She completed her handover notes. She drank half a cup of terrible coffee. She drove home in the gray November morning, and she sat in her car for a few minutes before she went inside, and she thought about Mark Carter's voice when he said, "Thank you, SEAL," and she thought about the look on Hayes' face in the conference room, and she thought about the 9 years of her life that she kept in a box in the back of a mental drawer and rarely opened. Then she went inside, took a shower, and slept for 6 hours. When she came back that evening for her next shift, the hospital felt different. It was subtle, the kind of different that you couldn't point to. No one was acting dramatically differently. No one stopped talking when she walked past. No one did anything that could be identified and addressed. But she had spent years in environments where the information below the surface was more important than the information above it, and she could feel it. The shift in the current, the way eyes moved a fraction of a second differently than they had the day before. People knew something. Not everything, but something. Janet Morse found her at the medication cart at 9 p.m. Word travels, Janet said without preamble. What word? Clara asked. Mark Carter asked to see you this afternoon 3 times. The charge nurse told him you weren't on shift. He told her to write it in his chart that he wanted you specifically assigned to his recovery care. Clara said nothing. Dr. Hayes denied the request, Janet said. That's within his authority. Clara, Janet lowered her voice, not because anyone was listening, but because what she was about to say felt like it required the register of honesty. He went to Sims, Hayes did, this afternoon after the meeting. I don't know what he said, but Sims looked like she'd been given a migraine by hand delivery when she came out. Okay, Janet stared at her. That's all you've got. What would you like me to say? I don't know, I'd like you to seem slightly bothered by the fact that a surgeon with 22 years of institutional credibility is apparently building a case against you. Clara finished counting the medications in the tray. She made her notation. He can build whatever he wants to build, she said. I know what happened in that room, and so does everyone who was in it, and so does the imaging record. She looked at Janet. And Mark Carter is alive. Janet was quiet for a moment. He's asking about you, you know. Carter. The recovery nurses say he's been asking questions. What kind of questions? About your background, about where you came from, how long you've been here. Janet paused. One of the nurses told him you were prior military, and he apparently said, I know, and didn't elaborate. Clara closed the medication tray. He's going to be fine, she said. He's a strong patient. Clara, Janet, I appreciate it, I do, but I'm going to go do my job now. She picked up her chart. That's what I'm here for. She was in the middle of checking on a post-op patient in room 14 when her pager went off with a message from Dr. Sims' office. Not a call, a page. The difference mattered. A page meant written record, meant formality, meant that whatever was coming had been considered carefully enough to leave a paper trail. She finished her patient check. She made her notes. Then she walked to Sims's office. The door was open. Sims was at her desk. She looked up when Clara appeared in the doorway, and her expression was the careful, considered expression of someone navigating a situation that had more vectors than she had anticipated. Sit down, Clara. Clara sat. Sims folded her hands on the desk. I've been on 3 calls today that I did not expect to be on. Clara waited. The first was with Dr. Hayes. I think you've already gathered the broad outlines of that conversation. Sims looked at her steadily. The second was with Commander Richard Voss at Naval Special Warfare Command. Clara went very still. He called us, Sims continued, not the other way around. Apparently, Sergeant Carter, who as it turns out is a more motivated patient than most, managed to get a message out this morning before we could have reasonably expected anyone to have the full story. He contacted his command and he gave them your name. The stillness in Clara had a different quality now. It was the stillness of someone recalibrating. The third call, Sims said, was with Naval Medical Center Administration. They are interested in this situation. Specifically, they are interested in you. Clara exhaled slowly through her nose. Dr. Sims, I left that life behind for reasons that were, I know, Sims said, and I'm not here to pull you back into it. But Clara, you have to understand what happened today. When a Navy SEAL uses an unofficial channel to contact his command from a hospital bed to advocate for a nurse, that is not a small thing. That is a significant thing. And when Naval Special Warfare Command then calls a civilian hospital to inquire about that nurse, that is a very significant thing. She paused. What they told me about your record. My record is classified, Clara said carefully. The parts I was told are not classified. What did they tell you? Sims looked at her for a long moment. That you are the most decorated combat medic in Naval Special Warfare history. She let that sit. That you held the rank of Chief Petty Officer. That your actions on 3 separate occasions in the field directly resulted in the survival of personnel who, by every objective medical assessment, should not have survived. Another pause. And that you left voluntarily, at the top of your career, 2 years ago, and that nobody who knew you fully understood why. The office was very quiet. Clara looked at the edge of Sims' desk, the grain of the wood, the small stack of folders at the corner. I was tired, she said. It was the truth. Not the whole truth, but a true piece of it. Tired, Sims repeated. Tired of the cost of it. Clara looked up. You make decisions in the field and they save people, and that's the good part. But the weight of the decisions, the accumulated weight, it doesn't go away. I wanted to save people somewhere the math was simpler, somewhere I could go home and leave it there. She paused. Apparently that was optimistic. The ghost of something moved across Sim's face that might, in different circumstances, have been the beginning of a smile. Hayes wants you suspended pending a formal procedure review, Sim said. He submitted the formal request this afternoon. I have it on my desk. Clara nodded. I have not signed it, Sim said, and I do not intend to sign it. Clara looked at her. I want to be honest with you about what I think is going to happen, Sims continued. Hayes has 22 years here. He has relationships with the board. He has a record that, complicated personality aside, Olishuene is genuinely distinguished. He is going to push on this, and he is not going to stop pushing. The fact that you saved a patient does not automatically neutralize the procedural questions he's raising, and there will be people on the formal review committee who will hear those questions and take them seriously regardless of outcome. I understand. What I also want you to understand, boss, Sim said, leaning forward slightly, is that Commander Voss told me something else. He told me that the Navy intends to formally recognize Sergeant Carter's medical intervention and the care he received as part of the after-action documentation for his operation, and that Clara Bennett's name will be in that documentation. She let that sit. That is not a small thing either. Clara was quiet for a moment. When does the formal review begin? Hayes wants it Thursday. I've agreed to Friday. 3 days. Yes, Clara stood. Thank you for telling me. Clara. Sim stood as well. There was something in her posture that was less administrative and more simply human. For what it's worth, and I understand it may not be worth much given the circumstances, I have been running nursing administration in this hospital for 8 years. I have seen nurses make bad calls. I have seen nurses make good calls for bad reasons. What you did last night was the right call made correctly in the right moment, and the only thing I can find to criticize about it is that it happened inside a system that wasn't built for someone like you. She paused. I think that's the system's problem, not yours. Clara looked at her. Something in her chest shifted, small and involuntary, the way things shift when you have been carrying a weight alone for a long time, and someone simply acknowledges that you have been carrying it. Good night, Dr. Sims, she said. She walked back into the corridor. At 10:45 p.m., she was passing the recovery wing, not assigned there, not heading there on purpose, simply on her way from the supply room to the East Nursing Station when she heard her name. She stopped. It was Mark Carter's voice coming from his room, and it was directed at someone else. She could hear a second voice, another man lower, and measured the voice of someone who was choosing his words with professional care. She did not go in. She stood in the corridor, not intentionally eavesdropping and not moving away either, and she heard Mark say clearly enough, I don't care about the hospital's internal politics. I care about what happens to her. The other voice said something she couldn't make out. Then make it happen, Mark said. That's what I'm asking. That's the whole ask, one phone call. She moved on. At 11:50 p.m., she was at the nursing station when her phone buzzed. Not her work phone. Her personal cell, which she kept in her pocket because the hospital allowed it, and because in 4 months she had received almost no personal calls while on shift. The number on the screen was a Virginia area code she did not recognize. She answered. This is Commander Richard Voss, the voice said. Naval Special Warfare Command. I apologize for the hour. Sergeant Carter said you'd be on shift, and I wanted to reach you before Thursday. Clara looked at the nursing station. 2 other nurses were on the far end, deep in their own work. She stepped around the corner into the supply alcove. Commander, she said. You know who I am. I know your name. Then you probably know why I'm calling. I have a guess. He paused. Chief Bennett, I'm going to be straightforward with you. Mark Carter told us what happened last night. He told us in detail. He also told us about the physician who refused to listen and the review that's been opened. A beat. The Navy's position on this is that a decorated combat medic who performed a textbook emergency procedure and saved the life of a SEAL operator should not be facing a suspension hearing. That is our position, and we intend to make it known. Clara leaned against the shelf. Commander, I appreciate the support, but I'm not Navy anymore. I'm a civilian nurse at a civilian hospital, and their review process is subject to significant pressure when the United States Navy formally documents the role of a specific civilian medical professional in the survival of an active duty SEAL operator during the post-operation period, Voss said, which is what we intend to do. Thursday's review, if it proceeds, will proceed with a formal statement from this command on the record. Claire was quiet. Carter's going to be okay, Voss said, and his voice shifted just slightly less official, more human. He wanted me to tell you that. He said you'd appreciate the direct communication. He knows me better than he should for a man I met yesterday, Claire said. He's a good reader of people. It's most of what the mob says. A pause. He also told me, and I'm choosing to pass this on, that the way you handled yourself in that room reminded him of the best operators he's worked with. His words, not mine. He said you moved like someone who's already decided the outcome and is just managing the steps. Clara closed her eyes for 1 second, 1 single second, in the bark of the supply alcove. ODD. Tell him thank you, she said, and tell him to rest. I'll tell him the first part, Voss said, and she could hear something in his voice that was almost amusement. The second part he's unlikely to honor. She went back to her station. She finished her shift. She filed her notes with the same even handwriting she always used. At 5:47 in the morning, as the overnight shift was bleeding into day, Hayes appeared at the far end of the corridor. He was not on shift. He was not scheduled. He was wearing civilian clothes, which meant he had come in specifically, which meant something had happened or something was about to. He saw her. He walked toward her. She did not move toward him or away from him. She simply waited, chart in hand, and let him cover the distance between them, because the distance between them was his to cover. He stopped 2 feet away. He looked at her for a long moment, a different kind of looking than before, less dismissive, more searching, and then he said in a voice stripped of all its professional armor, barely above a murmur, "How long did you know last night? Before you said anything? How long did you already know what was wrong with him?" Clara looked at him steadily. From the moment the gurney came through the door, Hayes absorbed that. She watched it move through him, watched the implications of it rearrange something in his expression, and the process was not comfortable for him, and she did not make it comfortable. "You should have pushed harder," he said finally, "in the room. You should have." "I pushed as hard as the situation I was in allowed me to push," she said. "I am a nurse here. You made the structure of that room very clear from the beginning." He looked at her. "I didn't know." "You didn't ask." The morning light from the end of the corridor reached them. Hayes stood in it, a man who had spent 22 years being the authority in every room he entered, and he looked in that moment like someone who had just understood, really understood, not intellectually but viscerally, that authority and judgment were not the same thing and had perhaps never been. He didn't apologize. Not then. She hadn't expected him to. He simply turned and walked back down the corridor, and Clara watched him go, and then she looked down at the chart in her hands and made her final notation of the night. The review was in 2 days. She was ready. Friday arrived the way difficult things often do, quietly without ceremony, as if the day itself had decided not to announce what it was carrying. Clara was up before her alarm. She made coffee she didn't drink. She sat at her kitchen table in the early dark, and she didn't think about the review. Not exactly, she thought around it the way you think around something large, when looking at it directly costs more than you want to spend before 7 in the morning. She had been in harder rooms than a hospital conference room. She had made harder calls than the one being reviewed, but this was different in a way she couldn't quite articulate, and she sat with that difference for a while before she got dressed and drove in. The review was scheduled for 9 a.m. in Conference Room B, which was larger than the room where Sims had spoken to her Tuesday morning. The size was intentional. Larger rooms meant more seats, and more seats meant more people, and more people meant the outcome would carry institutional weight in whatever direction it landed. She arrived at 8:15. Janet Morse was waiting for her near the elevator, holding 2 cups of coffee from the cart downstairs. The good cart, not the nursing station machine, and she handed one to Clara without saying anything. Clara took it. They stood together in the corridor for a moment, not talking, and it was the most support Clara had felt in 4 months, and she didn't say so because she didn't need to. "Who's on the panel?" Clara asked. "Sims, obviously. Gerald Holt. Dr. Lawrence from surgery, not Hayes's department, which I think Sims engineered intentionally. A woman from HR named Caldwell. And somebody new, Janet kept her voice low. A man I don't recognize. Came in this morning with a visitor badge and a Navy uniform. Clara went still. Active duty. Very much so. Commander something, signed in at the front desk at 7:45. Janet looked at her. You know who that is? I think so. Is that good or bad? Clara drank her coffee. I genuinely don't know yet. She walked into the conference room and at 8:58, Hayes was already there seated on the right side of the table, and he had brought someone with him, a man in a suit that read attorney, the way certain shoes read money present, but not announced position slightly behind Hayes's right shoulder in the configuration of someone whose function was support. Clara registered this without reacting to it. She had expected something like it. The rest of the panel filed in over the next 3 minutes. Sims took the center seat. Holt sat beside her. Dr. Lawrence, a compact, serious woman in her late 40s, who Clara had interacted with exactly twice, sat on Sims's other side. The HR representative Caldwell set up a laptop at the end. And then the man in uniform came in last and took the seat at the far corner of the table, and Clara recognized him from the voice on the phone 2 nights ago, even before he introduced himself. Commander Richard Voss was in his mid-50s, with the kind of face that had learned to hold its own counsel in situations that would crack most people's composure. He nodded briefly at Clara when he sat down. He did not smile. Neither did she. Hayes leaned toward his attorney and said something low. The attorney wrote something. Sims called the room to order. This is a formal practice review convened under Hospital Policy 12-7 regarding clinical events of November 19th. Participating are hospital administration, clinical department, leadership, human resources, and a representative from Naval Special Warfare Command who is present in an advisory capacity at the Navy's formal request. She looked around the table. This is not a disciplinary hearing. This is a review. The outcome may or may not generate recommendations for further action, which would be handled through a separate process. Everyone understand that clearly. Heads around the table, Hayes' attorney made another note. Good, said Sims. Dr. Hayes, you submitted the initial request for review. I'll give you the floor to outline your concerns. Hayes straightened. He had dressed carefully, not that he didn't always dress carefully, but today there was a specific quality to it. The precision of someone who understands that presentation is part of argument. On the night of November 19th, he began, Nurse Clara Bennett, assigned to trauma backup coverage, performed an invasive emergency procedure on a patient under my care, without physician authorization, without following established chain of command protocols, and without my direction. The procedure in question, a needle thoracostomy, is classified under this hospital's clinical practice standards as a physician-level intervention. The nursing scope of practice document section 4, paragraph 8 is unambiguous on this point. He set a printed copy of the document on the table as if the room hadn't known it existed. I am not disputing the outcome of the procedure. I am disputing the precedent that would be set if this institution allows the outcome to retroactively justify the process. He sat back. Sims said, Thank you, Dr. Hayes. Clara, you have heard the concern outlined. Would you like to respond? Clara set her hands flat on the table. I would. She didn't stand standing would have made it performance, but she sat forward and her voice was level and clear. At 11:47 p.m. on November 19th, I identified signs consistent with developing tension pneumothorax in Sergeant Carter. I communicated this to Dr. Hayes on 2 separate occasions. He directed me to be silent on both occasions. When the patient began to actively decompensate oxygen saturation at 83 and falling blood pressure dropping tracheal deviation present, I made the determination that waiting for physician direction would result in the patient's death. I performed needle decompression. The patient's saturation recovered to 97 within approximately 90 seconds. The imaging subsequently confirmed left-sided tension pneumothorax. The procedure was necessary, correct, and executed without error. She paused. I also want to address something Dr. Hayes said, that he is not disputing the outcome. I want this panel to sit with that for a moment. A man is alive. Dr. Hayes is not disputing that the man is alive. He is asking this institution to concern itself with the paperwork architecture of how the man came to be alive, while the man who is alive is down the hall in recovery. She looked at Hayes directly. I understand why process matters. I spent 9 years in environments where process failures killed people. But process is a tool. It is not the object. The object is the patient. Hayes's jaw was tight. His attorney touched his arm lightly, the restraining gesture of someone whose job was to keep their client from speaking before they should. Ms. Bennett, said Caldwell from HR, carefully neutral. Can you speak to your clinical background as it relates to the procedure you performed? I was a special operations combat medic with naval special warfare for 9 years, 3 combat deployments. I have performed needle decompression in field conditions on multiple occasions. I have performed it under fire. The clinical knowledge and procedural competency required for the intervention are not in question. Caldwell made a note. Dr. Lawrence was leaning forward slightly, with the expression of someone who was working very hard not to let their opinions show on their face and was not entirely succeeding. Commander Voss spoke for the first time. If I may. Sims nodded. Chief Petty Officer Clara Bennett, her rank at separation, was the highest-rated Special Operations combat medic in her unit's history. She holds 3 commendations for medical interventions under combat conditions, 2 of which involve procedures that the military's own Field Medicine Review Board classified as exceptional. The third, and I'm authorized to state this, involved keeping 3 operators alive for 6 hours in an unsupported position until medevac could reach them, using equipment that most trauma surgeons in this country have never had to make substitutions for. He looked at Hayes, not with hostility, with something more uncomfortable than hostility, with the quiet weight of information being delivered to someone who needs to update their understanding. She performed a needle decompression in a well-lit, fully equipped trauma bay with a stable patient table and a monitor telling her exactly what she needed to know. I want to put that in context. The room was completely quiet. Hayes's attorney was writing. Hayes himself was looking at the table surface. His expression had gone somewhere private and unreadable. Dr. Hayes, said Sims carefully, is there anything you'd like to say in response to Commander Voss's statement? Hayes looked up. The Navy's assessment of her field record is noted, he said, and his voice was controlled and flat, and you could hear the effort in the control. My concern remains procedural. With respect, said Dr. Lawrence, speaking for the first time, and she was looking at Hayes with an expression that carried less collegiality than the situation called for. The procedure was correct. The timing was correct. The patient outcome is unambiguous. If she had waited for physician direction, we would be having a different conversation, and it would be much worse. She is not a physician. No, Lawrence said. She is something else. And maybe the question this review should be asking isn't why she acted, but why we haven't created a framework in which someone with her training is formally authorized to act. She looked at Sims. Because she is going to face this situation again. Not because she seeks it out, but because she will see things and she will be right about what she sees. And the next time, if we haven't addressed this, we'll be back in this room. Hayes looked at Lawrence with the expression of someone who had thought he had counted the votes correctly and was now understanding he had missed one. Sims said, I want to move to Sergeant Carter's statement. The room shifted. Sergeant Carter provided a written statement to this panel yesterday afternoon, Sims continued. I'm going to read the relevant portion into the record. She picked up a sheet of paper. Quote, I want to be clear about what happened on the night of November 19th. Clara Bennett identified what was killing me before any physician in that room did. She communicated it clearly and was dismissed. She communicated it again and was dismissed again. She then did the only thing that a trained, experienced, and morally responsible medical professional in her position could do. She acted. I am alive because she acted. I have been in enough life or death situations to know the difference between someone who hesitated and someone who did not. She did not hesitate. Whatever this institution decides about procedure and paperwork, I want that sentence in the record. She did not hesitate. End quote. The silence after that had a different quality than all the previous silences. Hayes was very still. His attorney put down his pen. Clara looked at the paper in Sims' hand and something moved through her, not pride exactly, not vindication, something older and quieter than either of those things. The particular feeling of being seen by someone who knows what they are looking at. Then the door opened. Everyone at the table turned toward it. The man standing in the doorway was in a hospital gown. His own hospital gown, the kind that said he had come from a room in this building, rather than from outside it, and he was holding his IV pole the same way he'd held it 2 days ago in the hallway, and his face had the particular color of someone who had recently lost a significant amount of blood and was operating now on the kind of stubbornness that substitutes for energy. Mark Carter stood in the doorway of conference room B and looked at the table. "I was told this started at 9, he said. He looked at the clock on the wall. "It is 9:22. I have been trying to get out of that room since 8:30. He looked at the recovery nurse behind him, a different one from Tuesday, a young man who had clearly attempted several times to prevent this and had learned that attempting to prevent Mark Carter from doing something he had decided to do was not a productive use of anyone's time. "Thank you, Rodriguez. You can wait outside." Rodriguez looked at Sims. Sims made the slightest gesture, the kind that means stand down, and Rodriguez stepped back. Mark moved to the table. He didn't sit. Standing was clearly costing him something, but the cost was one he had decided to pay. Hayes looked at him. "Sergeant, you should be in." "I know where I should be," Mark said, not rudely, simply as a statement of fact. "I have a question for this panel." He looked at Sims. "One question." "May I?" Sims looked at him for a moment. "Go ahead." Mark looked at Hayes, directly, without preamble. "In your 22 years, he said, how many patients have died that you think shouldn't have?" Hayes stared at him. "I don't mean because you made an error. I mean because the system was wrong or the timing was wrong or someone in the chain of things didn't have the authority to do what needed doing in the moment it needed doing." He paused. "Because in my career, I have watched people die from those gaps. The gap between what someone knew and what they were allowed to do. The gap between the right answer and the authorized answer." Another pause. "Clara Bennett is the reason I'm standing here barely instead of being in a bag. She closed a gap that was going to kill me, and you want to punish her for closing it. I genuinely want to understand your thinking." The room breathed in and didn't breathe out. Hayes was quiet for a long time, long enough that everyone at the table felt the weight of it. "I don't want to punish her," he said finally, and his voice had come down from all its professional scaffolding and was something closer to just a voice. "I want the institution to hold." "Then build an institution that deserves to hold," Mark said. He put his hand on the back of the nearest chair, not to sit in it, but to steady himself, and the effort was visible, and he didn't try to hide it, and the room saw it, and nobody spoke. Commander Voss said quietly, "Sergeant, sit down before you make Dr. Lawrence's morning any harder." Mark sat. He looked like a man who had planned to remain standing and was glad to have been given a reason not to. Sims set down her paper. She looked around the table. She had the expression of someone who has been managing a complicated equation and has just watched several of its variables resolve simultaneously. "I'm going to table the formal finding for 48 hours, she said. "Before I issue any recommendation, I want to consult with clinical leadership and with Commander Voss regarding a potential framework adjustment, specifically whether this institution should formally authorize a specialist trauma medic classification that accounts for combat medicine credentials in emergency protocol authorization." She looked at Hayes. "Robert, that would address your procedural concern at the structural level rather than through individual discipline." Hayes looked at her. He looked at Clara. He looked at Mark Carter, who was sitting in a hospital gown at a conference table holding an IV pole and who had just asked him a question he didn't have a clean answer to. "Fine," he said. It was such a small word for such a large concession that it took the room a moment to register it. "Fine," Sims repeated. "All right, I'm adjourning the formal session. Everyone stays available for follow-up. Clara, I want you in my office at 2 p.m. She paused. "Mark, why want you back in your room in the next 5 minutes, or I am going to have to apologize to your recovery team." 4 minutes, Mark said. "I need to say something first." Sims looked at him. 30 seconds. He looked at Clara. The table between them was long, and the room was full of people, and none of that mattered. "I told command about you," he said. "I know you didn't ask me to. I know you might be angry about it, but I've been in rooms where the right person wasn't recognized because they were quiet, and the wrong person was recognized because they were loud, and I have watched what that does over time, and I decided a long time ago that I would not be the person who stayed quiet when the record needed correcting." He held her gaze. Your record needed correcting. Clara looked at him. The thing in her chest that had shifted when Sims spoke about her carrying weight alone shifted again further, this time, and she held it steady. Thank you, Sergeant, she said. Mark. Mark, she said. He stood carefully and retrieved his IV pole, and he walked back out of the conference room with Rodriguez hovering behind him, and the door swung shut. Hayes's attorney began gathering his papers. Hayes himself sat for a moment longer. He was looking at the door through which Mark had just left, and his face was doing the slow, effortful work of a man who is honest enough with his son to know when something has shifted, but stubborn enough that the shift costs him something real. He looked at Clara. She looked back. 2 patients, he said quietly, so quietly that it was almost private in a room that was not private. In 22 years, 2 patients, I think, died in that gap you just heard described. He stood. He straightened his jacket. I handled it by moving faster. I never considered that the person who needed to move wasn't always going to be me. He left the room before she could respond. The remaining panel members dispersed. Voss lingered as they filed out, and when the room was down to him and Clara, he said, "That was the cleanest version of that I've seen in a while." "It's not over," she said. "No," he agreed, "but the direction is clear now." He stood straightening his uniform with the automatic precision of long habit. "Carter wants to know if you'll come by his room this afternoon before your meeting with Sims." "I'll come by," she said. "He'll complain about the food. He's a SEAL in a hospital, that's standard." Voss almost smiled. "Welcome back, Chief." "I'm not back," Clara said. "No," he said, and this time the almost smile made it all the way. "You never left. That's the thing, isn't it?" He walked out. Clara sat alone in conference room B for 1 minute, 60 seconds of quiet in the middle of everything. She looked at the table and she breathed, and she let herself feel briefly the full weight of the last 3 days. Not the procedural weight, not the professional weight, but the human weight. The accumulated cost of being seen when you have spent years learning to be unseen. The strange vulnerability of being known. Then she stood up. She pushed her chair in. She picked up her coffee cup, which had been sitting untouched since she'd carried it in at 8:58. She had a shift starting at noon. She had patients to attend to. She had work to do, and the work was the thing she had come here for, and it was still the thing under everything that mattered most. The drama would resolve the way drama resolves, not cleanly, not immediately, but in the direction that reality eventually enforces on even the most resistant people. She walked out into the corridor, and the hospital received her back into its rhythm, and she moved through it the way she always moved, with the same unhurried purpose, the same even breath, the same eyes that watched everything and gave away nothing. But something underneath all of that was different. Something had been said out loud that could not be unsaid. And whether she wanted it or not, whether she had asked for it or not, the shape of things here had changed. She could feel it in the way the corridor felt when she walked through it now, not more comfortable exactly, but more honest. More like the place it actually was rather than the place she had agreed to pretend it was in order to keep the peace. She had not come here to keep the peace. She had come here to do her job. And for the first time in 4 months, those 2 things were pointing in the same direction. The 2 hours between the review and her noon shift were the kind of hours that feel longer than they are because the mind won't leave them alone. Clara spent the first 40 minutes in Mark Carter's room, which was more or less what she had expected it to be, a room occupied by a man who was healing faster than the medical staff thought reasonable, and who was using the extra energy to be comprehensively dissatisfied with every non-medical aspect of his situation. The food, as Voss had predicted, came up within the first 90 seconds. "It's institutional," Clara said. "It's punishment," Mark said. "You're alive to complain about it." Reframe. He looked at her with the expression of a man who recognized a tactical redirect and respected it without complying with it. Then he shifted in his bed more carefully than he would have wanted to, she noticed. And the care told her more about his actual pain level than he would have volunteered, and he said, "How did it go?" Sims tabled the finding, 48 hours. "That's good. It's incomplete, but directionally good." "Directionally good," she agreed. He was quiet for a moment. The monitors beside his bed kept their patient rhythm. Outside in the corridor, someone was wheeling something, the wheel squeak moving past and fading. "Hayes," he said. "What about him? What's he going to do?" Clara considered the question carefully because She had been considering it since Hayes walked out of the conference room. I think he's going to do what genuinely principled and genuinely difficult people do when they get cornered by their own principles, she said. I think he's going to make it harder before he makes it easier. Mark nodded slowly, like someone who found that answer familiar. What do you need from me? You've done enough, Mark. That's not an answer to the question I asked. She looked at him. He looked back. They were, she thought, very similar in the particular way that people are similar when they have been shaped by the same category of experience, not identical, not even alike in most surface ways, but similar in the way two different tools are similar when they have been made for the same kind of work. Nothing right now, she said. Rest. Let your body do what it needs to do. And if something changes, I'll tell you. Clara, I'll tell you, she said again, and this time there was enough weight in it that he let it go. She was at the nursing station by 11:40, suited up and into the rhythm of her shift before noon hit. The ward had its usual mid-morning energy, not the compressed urgency of overnight, not yet the afternoon density of procedures and family visits, but a kind of steady working hum that she found honestly more stabilizing than any other time of day. You could put your head down and work, and the work was clear, and the purpose was clear, and the complications for a few hours were the manageable kind. At 12:17, Dr. Lawrence appeared at the nursing station. Lawrence was not assigned to this ward. She had no scheduled reason to be here. She stood at the counter with the slight awkwardness of someone who has come to say something personal and is not entirely comfortable with the personal register. Bennett, she said at Dr. Lawrence, what you said in the review about process being a tool. Lawrence crossed her arms, which was less hostile than it looked. It was her thinking posture, Clara had observed. I've been saying a version of that for 6 years and nobody's listened. People listen when the context gives them no alternative, Clara said. That's depressing. It's accurate. Lawrence looked at her with the flat, intelligent appraisal of someone who was recategorizing a person in real time. I put in a consultation request this morning, she said, for a clinical credentialing review, combat medicine specialty track. It doesn't exist yet as a formal classification, but I've asked administration to evaluate creating one. She paused. It would, if approved, formalize the scope of practice for personnel with your kind of background. Retroactively, among other things. Clara went still. That's not a small thing to put your name on. No, Lawrence said, it isn't. Hayes won't like it. Hayes can express his feelings through the appropriate channels. Lawrence uncrossed her arms. For what it's worth, I checked your transfer file this morning. The part that isn't classified. She looked at Clara steadily. You should have been placed in trauma from the start. Whoever assessed you at intake underestimated your credentials. I want to understand why that happened. I didn't correct them, Clara said. Lawrence stared at her. Why not? Clara looked at the chart in front of her. Because I wanted to see if I could do this quietly. Just work. Be a nurse, not a SEAL medic, not a record. Just someone who showed up and did the job. Lawrence was quiet for a moment. How'd that work out for you? Clara looked up. Jury's still technically out. Lawrence made a sound that was not quite a laugh, but was adjacent to one. She straightened. 2 p.m. with Sims. I'll be there. She left. Clara watched her go and felt very briefly the particular relief of having an ally you hadn't expected in a corner you hadn't known you needed covered. The next 90 minutes were by design, just work. She checked her patients. She updated her charts. She coordinated with the pharmacy on 2 medication adjustments and talked a post-operative veteran through his fear of the transition to outpatient care with the careful, concrete honesty that she had found worked better than reassurance, not, it will be fine, but here's what you do, and here is why it works, and here is who to call when it doesn't, and here is what that call sounds like. Practical, real. The kind of information that treats people as capable of handling their own lives. At 1:45, Janet caught her in the hallway. Hayes called a department meeting, Janet said, and her voice had the specific quality of someone delivering information they consider important. Surgery, 30 minutes ago, behind closed doors. Clara kept walking. He's allowed to do that. Clara, his attorney, was there. She slowed fractionally. Still allowed. The charge nurse from trauma overnight, Kim Reyes, you know her? Clara nodded. She was pulled in 20 minutes after the meeting started. She was in there for a while, When she came out, she looked like she'd been put through a very polite ringer. Kim Reyes had been in the trauma bay on the night of the 19th. She had been one of the nurses working the far side of the cart when Hayes had dismissed Clara's concern the second time. She was young, 2 years out of nursing school, and she was good at her job, and Clara knew, not yet in a position where she could afford to be in the middle of something like this without consequences. Clara stopped walking. Is she okay? She's shaken. I talked to her briefly. She said Hayes didn't threaten her exactly, but he asked a lot of questions about what she observed and what she remembered, and whether she had any concerns about the procedure Clara performed. What did she say? She said she told him she observed a nurse save a patient's life. Janet paused. She also said she cried in the bathroom afterward, which I think qualifies as shaken. Clara looked at the clock on the wall. 14 minutes until 2 p.m. Where is she now? Break room, I think. She found Kim Reyes in the break room, sitting with both hands wrapped around a mug of tea, staring at the table with the expression of someone who has recently been reminded of the gap between how they thought the world worked and how it actually works. She was 26 years old, Clara knew, and she had a younger sister she talked about sometimes, and she had once 3 weeks ago complimented Clara's penmanship on a chart annotation in a way that was so earnest it had caught Clara off guard. Clara sat across from her. Kim looked up. Something flickered across her face, relief maybe, or the anticipation of relief. I didn't tell him anything that wasn't true, Kim said immediately. I know, Clara said. I said what I saw. I saw you try to tell him twice, and I saw what you did, and I saw what happened afterward. Her jaw was tight with the effort of holding herself steady. He kept asking me if I was sure, over and over, in this very calm, very patient way, like if he asked enough times I would eventually remember it differently. That's a technique, Clara said. It's an old one. It works on people who aren't sure of what they saw. You're sure. I'm sure. Kim's hands tightened on the mug. But I'm also 26 and he's been here since before I was born, and I don't have, she stopped. You don't have the institutional armor yet, Clara said. Kim exhaled. Yeah, Kim. Clara waited until the younger woman looked at her. What you said to him was exactly right. You don't need armor for the truth. The truth is its own structure. You stand inside it and it holds. Every time someone asks you again, you say the same thing because it's the same thing that happened. She paused. Can you do that? Kim looked at her for a long moment. Something settled in her face, not completely, but enough. Yeah, she said quietly. Yeah, I can do that. Clara stood. Drink your tea. She walked into Dr. Sims' office at 2 p.m. to find that the 48 hours Sims had requested had collapsed into something more immediate. The room had more people in it than she had anticipated. Sims behind her desk, Lawrence beside the window. Commander Voss, still in uniform, seated near the door. He had not left the building apparently, which told its own story. Gerald Holt, and 2 people she didn't recognize. A woman in her 60s with the bearing of someone accustomed to the top of organizational charts, and a man beside her holding a tablet and looking at it with the focused attention of someone managing incoming information in real time. Sims said, Clara, this is Dr. Margaret Chen. She's the Chief of Clinical Operations for the National Military Medical Center System. Clara looked at Dr. Chen. Dr. Chen looked at Clara with the specific calibrated attention of someone who has read a file and is now checking it against the original. Sit down, please, Sims said. Clara sat. Things moved faster than expected this afternoon, Sims said, and there was something in her voice that was not quite tension and not quite excitement, the tone of someone steering through moving water. At approximately 1 p.m., this hospital received a formal communication from the Department of the Navy Office of Special Warfare regarding the clinical events of November 19th and their after-action documentation status. The communication recommends formally that the hospital review its clinical protocol authorization framework with specific reference to combat-certified medical personnel. She looked at Clara. It also formally recognizes your intervention as the determining factor in Sergeant Carter's survival. In writing, Voss said from near the door. Signed and dated, in the official after-action record. Clara was very still. Simultaneously, Sims continued. Dr. Hayes submitted a formal complaint to the hospital board regarding the conduct of this review, which he characterizes as biased and insufficiently impartial. Her voice remained even. The board convened a preliminary session 90 minutes ago. Dr. Chen was in that session. All eyes moved to Chen. The older woman looked at Clara with the considered gaze of someone who has been in enough institutional battles to have a theory about which ones matter. "I've reviewed the clinical documentation from the 19th, she said. "The imaging records, the monitor logs, the nursing notes, the attending notes, all of it. I have also reviewed Dr. Hayes's formal complaint." She paused. "The clinical record is unambiguous. The presenting symptoms, the intervention, the outcome. There is no credible reading of the clinical record that supports the position that your action was anything other than the correct and necessary one." She let that sit for a moment. "The board's preliminary position," Chen continued, "is that the procedural question whether a nurse may perform this intervention is a valid institutional question that deserves a clear answer going forward, and that the answer should be developed thoughtfully in collaboration with clinical leadership rather than adjudicated through disciplinary action against an individual who, in the absence of an existing framework, used her professional judgment and her documented expertise to save a patient's life." Another pause. "That is the board's preliminary position. It is not final, but it is where we are at 2:15 p.m. on a Friday." Clara looked around the room. Voss had his hands folded, and his expression was carefully neutral, but there was something in his posture that she recognized, the particular stillness of someone who has been working toward an outcome and can see it beginning to arrive. "What about Hayes's complaint?" Clara asked. "Sim." Chen looked at her. "The complaint is being reviewed. It will be addressed through proper process. I want to be honest with you. He has standing, he has relationships on the board, and his concerns about protocol won't be dismissed simply because the outcome was positive. But the weight of the clinical record, the Navy's formal communication, and frankly the statement Sergeant Carter gave to this panel this morning, collectively, they create a picture that is very difficult to read in the direction Dr. Hayes is asking the board to read it." Lawrence spoke from beside the window. "The credentialing proposal I submitted this morning, Chen is looking at it." Chen nodded. "It's a strong proposal. The framework it describes already exists in modified forms at 2 military treatment facilities. Adapting it for a civilian institution with mixed military and civilian patient population is doable. I'd estimate 6 to 8 weeks for formal implementation if administration commits." She looked at Clara. "Which would mean, among other things, that you would hold formal authorization for the category of intervention you performed on the 19th, retroactively as well as going forward." The room was quiet in a way that felt expectant rather than empty. Clara looked at Sims. "What do you need from me right now?" "Honesty," Sims said. "I need to know, and I'm asking this not as an administrator, but as the person sitting across from you, are you planning to stay?" The question landed cleanly in the silence. Clara hadn't expected it, which meant it hit somewhere real. "Yes," she said, and then because it was true and because the room had earned it, "this is where I want to be. Not the Navy, not a forward operating base. Here, this hospital, this work." She paused. "The situation I walked into 4 months ago is different from the situation I'm sitting in now, and I know that. But the reason I came here hasn't changed." Sims looked at her for a long moment. Then she nodded once with the weight of someone making a decision rather than recording one. "Okay," she said. The meeting lasted another 20 minutes, covering procedural details that Clara attended to with the same focused efficiency she brought to everything. When it ended, she was the last one out except for Voss, who waited in the corridor. "The Navy will have a formal representative at the credentialing presentation," he said. "I want you to know that." "You didn't have to stay all day," she said. "Carter asked me to. He asked you to babysit me. He said make sure it goes right, which I interpreted as babysitting yes." Voss looked at her with something that was almost warmth. "For what it's worth, it would have gone right without me. The record was always going to be the record." "Then why did he ask you to stay?" Voss considered this. "Because he wanted someone in the room who knew what they were looking at when they looked at you." He straightened. "Some things need a witness, Chief, not for the institution, for the person." She didn't have an answer for that. She was back on the ward floor by 3:15. The afternoon had the full density of a Friday family visitor shift changes the particular energy of a hospital approaching a weekend, which in a military facility meant families who had driven long distances and patients who were trying to calibrate hope against reality. She moved through it with the focused competence that was her natural state, and the work absorbed her the way work always did, which was the whole point of the work. At 4:42, her pager buzzed. Not a medical emergency, a message from the nursing station doctor. Hayes is asking to speak with you. He's at the East Station. She looked at the message for a moment, then she finished what she was doing, made her notation and walked to the East Station. Hayes was standing there alone, no attorney, no colleagues. His white coat was slightly less precise than usual, the kind of slight disarray that means someone has been at this since early morning and hasn't had a moment to recalibrate. He looked like what he was, a man who had been fighting something all day and was not entirely sure anymore what he was fighting it for. He saw her coming. He didn't shift into any performance posture. He just stood there and waited, and when she reached him, he said without preamble, "I called the board back at 3 p.m. She waited. I withdrew the formal complaint. The corridor noise continued around them, wheels and voices, and the overhead PA, and underneath all of it, something shifted in the air between them. "Why?" she asked. He looked at the middle distance for a moment. Not at her, not away, just at the neutral territory between them where difficult things could exist without direct ownership. "Because Kim Reyes spent 45 minutes telling me what happened in a room that I was also in," he said. "And she saw something different than what I've been telling myself I saw. And she's 26 years old with no reason to lie." He paused. "And because Carter's statement had a line in it I haven't been able to get out of my head all day." "Which line?" She did not hesitate. He said it quietly, like something he'd been turning over. "I've been doing this for 22 years, and there have been 3 moments, 3 where I did not hesitate, where I moved before my brain finished the sentence and just did the right thing. 3 moments in 22 years. He looked at her now. "You do that every time?" Clara looked at him. "I don't know what that cost you," he said. "I don't know what you carry from the places you've been. I don't have access to that, but I have been treating you as less than what you are since the day you walked in here, and that is..." He stopped. He started again. "That is something I need to own. Not in a formal apology in a conference room with administrators watching. I'm telling you now in a hallway, which is where it happened." The thing in Clara's chest moved again. Further this time. She let it. "It's a hard thing to say," she said. "It should be," he said, but they stood for a moment in the hallway of the hospital where neither of them had been anything close to comfortable for the past 4 days, and the ordinary sounds of the place continued around them, indifferent, inordinary, and somehow right. "For the record," Clara said, "you're a good surgeon." He looked at her. "That's a very careful sentence." "I'm a very careful person." Something moved on his face. It might have been the beginning of respect. Not the performed variety, the kind that gets displayed, but the quiet internal kind, the kind that changes how you see rather than how you act. "The credentialing proposal," he said. "Lawrence's." "What about it? I'm going to support it." He said it flatly as if stating a logistics decision. "I want that in the record for whatever Chen's process is, my formal support." He looked at her. "It should have existed before you walked in here. That's not your failure, it's ours." Clara nodded. He straightened his coat. He picked up the chart he'd set on the counter. He was going back to work, and so was she, and the enormous amount that had just happened between them would not be mentioned again today and might never be directly mentioned again. But it had happened, and they both knew it had happened, and the knowing was enough. "Good shift, Bennett," he said. "You too, doctor." He walked away. She watched him go. Then she turned back toward her patients, her charts, her work, the same work. It had always been in the same hallways with the same purpose underneath it, except nothing was quite the same anymore. The hospital felt like a place where the truth had been spoken and survived the speaking, and those places in her experience were rarer than they should be and more valuable than most people understood. Her pager buzzed again. She looked at it. Mark Carter's room. Message from the recovery nurse. "He's asking if you're coming back this evening. Says to tell you he has questions. Says to tell you it's important." She looked at the message for a moment. Then she paged back. "Tell him 7 p.m. and tell him the food is still institutional." The reply came 40 seconds later. He says fine, and also the coffee is worse than the food. She put her pager away. She arrived at Mark Carter's room at 7 p.m. exactly, which was the kind of punctuality that said something about a person without requiring commentary. He was sitting up in bed, which was more upright than he'd been that morning, and his color was better, not good. Not yet, but the particular shade of better that meant the body was doing its work and doing it properly. He had a folder on his lap. She noticed the folder before she noticed anything else because she had spent enough years in rooms where folders meant decisions to have developed an automatic awareness of them. "You look better," she said. "I feel terrible," he said. "Those aren't mutually exclusive." He almost smiled. How did the rest of the day go? She sat down in the chair beside his bed, not perched on the edge, not the posture of someone about to leave, but settled, which she did deliberately because he would read it, and she wanted him to know she had time. Hayes withdrew the formal complaint, she said. Mark went still. When 3 p.m. What changed? Kim Reyes told him what she saw. Apparently hearing it from someone young and uncomplicated and with nothing to gain made it real in a way the rest of the day hadn't. She paused. And your statement, that line, she did not hesitate. He couldn't get past it. Mark looked at the window. Something moved in his face, the kind of movement that happens when a person has been holding tension on behalf of someone else and is now carefully releasing it. "Good," he said, then quietly, "Good." "You said you had questions," Clara said. "Important ones." He looked at the folder on his lap. He didn't open it immediately. This was not hesitation. She knew what hesitation looked like in him, and this wasn't it. This was the deliberate pause of someone who wants to say the next thing correctly. "Before I show you this," he said, "I want to ask you something directly. And I want you to answer directly, not the way you answer when you're managing what someone's going to hear." She looked at him. "Okay. What made you leave?" The question was quieter than its weight suggested. Clara looked at her hands. She had answered a version of this for Sims, tired, she had said. The accumulated cost. And that was true. But Mark was asking the version underneath that version, and they both knew it. "There was a deployment," she said. "Third one, Eastern Theater. I don't tell this story." "You don't have to. I know." She was quiet for a moment. The monitor beside his bed kept its even rhythm, patient and indifferent. "We lost 3 people in a situation where the medical intervention was right and timely and correct, and they died anyway because of factors that had nothing to do with medicine. And afterward, the after-action report, the formal record, described the medical response as, quote, suboptimal." She paused. It wasn't. It was exactly what it should have been. But someone needed the record to say something else, and the record was adjusted, and the people who knew the truth were told in various careful ways that the truth was less important than the narrative. Mark was very still. "And I realized," Clara said, "that I had been operating in a system that I trusted to be honest, and it was not honest, and I didn't know how to keep doing the work inside a dishonest system." She looked up. "So I left. I thought if I went somewhere where the system was smaller, a hospital, a ward patients in front of me, maybe the dishonesty would be smaller too. More manageable, more human." "Was it?" Mark asked. She thought about Hayes pointing at her in the trauma bay. She thought about 4 months of being dismissed and minimized and boxed into a category that had never fit her. "Different," she said. "Not smaller, just different." Mark nodded slowly, then he opened the folder. He held it out to her. She took it. She looked at the first page. She read the heading and stopped. It was a formal proposal document, Naval Special Warfare Command letterhead. The title read Combat Medicine Integration Initiative, Civilian Medical Partnership Program, Pilot Site Designation. She looked up at him. "Voss drafted it based on what happened here," Mark said. "But the concept has been under discussion for 2 years. There are SEALs, Rangers, PJs, Special Operations medics with your level of training and more who separate from service and go into civilian medicine and get slotted into roles that use maybe 30% of what they know. Because civilian institutions don't have a framework for them. They don't know what to do with someone who's operated at that level in that context." He paused. "The proposal designates this hospital as a pilot site for a formal integration program. Combat-certified medics embedded in trauma teams with full authorization for the procedures they're trained to perform. Navy provides ongoing certification support. Hospital provides the infrastructure. The patient population here, active duty, veterans, their families, they get medical staff who understand the specific context of military injuries, military psychology, military experience. Clara was still looking at the document. Her eyes were moving through the page, but her mind was somewhere slightly different, somewhere that was processing not just the words, but the shape of what the words described, the way a person reads a map and sees not just the lines, but the territory. "This is real," she said. It wasn't a question. "It's real. Voss is presenting it to Naval Medical Command next Thursday. Chen has already indicated the hospital system would be receptive to the pilot designation." He watched her face. "Your name is in it, not as a subject, as the proposed program lead for the civilian side." She looked up. "You would hold a dual role," Mark said. "Clinical trauma team, full authorization, the credentialing Lawrence proposed, but with federal backing. An administrative building, the framework for integrating future candidates into the program. Identifying them, evaluating them, orienting them to civilian practice." He paused. "It's not the Navy. It's not a forward base. It's here. It's this hospital. It's the work you said you came here to do, but with the full weight of what you actually are behind it." The room was quiet. Clara set the folder on her knee. She looked at the monitor. She looked at the window. She looked at her hands. "Mark," she said, "I know, this is a large thing. I know that too. You did this from a hospital bed in 48 hours. I had help." He paused. "And I had motivation. The Navy doesn't like waste. Putting someone like you in a position where a man like Hayes can spend 4 months treating you like a floor lamp, that's waste. Institutional, systemic, expensive waste. And it gets people killed. Maybe not here, but it gets people killed somewhere in the version of this story where you weren't here on the 19th, or you were here and you stayed quiet because nobody had built a structure that told you that you were allowed to speak." His jaw was tight. "I don't accept that version of the story." Clara was quiet for a long moment, long enough that Mark, who was good at reading silences, let it be. Then she said, "The people in the after-action report, the 3 I lost, their names are in my file." He looked at her. "I want them acknowledged somewhere in the program documentation," she said. "Not publicly, not performatively, but somewhere in the official record, a note, a dedication, something that says this program exists in part because of what was learned from their deaths." She met his eyes. "That's my condition." Mark held her gaze for a moment. "Done," he said. "I'll tell Voss tonight." "Tonight you're sleeping," she said. "Clara, it'll hold until morning. Sleep." She stood. She picked up the folder. "Can I take this? It's yours." She looked at it in her hands for a moment, the weight of it, which was more than paper. Then she tucked it under her arm. "Thank you," she said, "for this, for all of it." "You did the work," he said. "I just made sure the right people saw it." She walked out into the corridor. The evening shift was in its full rhythm around her, the particular texture of a Friday night in a military hospital, busy but not chaotic, purposeful. The sound of care being administered by people who had chosen this and knew why they had chosen it. She stood in the corridor for a moment with the folder under her arm and the weight of the day settling around her, and she breathed once fully the way she had learned to breathe in the moments between things when the body needs to recalibrate before the next thing begins. Then she walked. It was Saturday morning when the next piece arrived, and it arrived in a way Clara had not anticipated. She was at the nursing station at 8 a.m. She had picked up a partial Saturday shift, not because she was required to, but because the rhythm of work was still the most stabilizing thing she had, and she wasn't quite ready to let go of it when Janet Morse appeared with the expression she wore when she was carrying an information she considered significant. "Board meeting," Janet said. "This morning. Emergency session." Clara looked up from her chart. "Hayes? His attorney filed something yesterday evening after the complaint withdrawal, a separate action. Not against you, specifically against the hospital administration, alleging that the review process was compromised by external pressure, specifically the Navy's involvement." Janet's voice was careful, the careful of someone who understands the information they're delivering is volatile. "He's claiming that Commander Voss's presence at the review constituted institutional coercion." Clara set her pen down. "Chen is handling it directly," Janet said. "Sims called me 20 minutes ago. She said to tell you the board is aware of the action and is treating it as a separate matter from your credentialing review, which remains on track. She paused. She also said, and she asked me to pass this on exactly, she said, tell Clara that the folder is moving and she should not worry about the noise. Clara looked at Janet. She said it like that. Word for word. I wrote it down because it sounded like a code. Janet tilted her head. Is it a code? Well, it means the program proposal is advancing, Clara said. The attorney's filing is Hayes trying to reopen a door that's already closed. It might slow things, it won't change them. She picked her pen back up. The clinical record is what it is. Janet looked at her for a moment with the expression of someone who is recalibrating their estimate of a person upward and finding the new number more comfortable than the old one. You're very calm about this. I've been shot at, Clara said. Fair point, said Janet and left. The emergency board session lasted 3 hours. Clara was not in it. She was on the ward floor doing her job, which was where she had decided to be and where she found she was most herself. She had her patients, she had her charts, she had the work, which was the whole point of the work. At 11:30, Kim Reyes found her. Kim had the look of someone who had slept poorly and decided to do something about it rather than wait for the sleeping to improve. She was in her civilian clothes, not on shift, and she had clearly come in specifically, which meant she had something specific to say. I gave a formal statement to the board this morning, Kim said. They asked for it, I submitted it in writing last night, and they called me in this morning to confirm it in person. Clara looked at her. Kim, I know you didn't ask me to. Her voice was steady, not the forced steadiness of someone performing composure, but the real kind, the kind that has been earned by making a decision and committing to it. But you told me to stand inside the truth because the truth is its own structure. So I did. I told them exactly what I saw. I told them about the 2 times you said something and the 2 times you were told to be quiet. I told them about the monitor and the numbers and what happened when you acted. She paused. I told them that if you hadn't done it, I would have watched someone die and not known what to do about it. And that I don't think that's acceptable. That being in a room where you know something is wrong and you're not authorized to act on it, that's not a system that works. And they needed to hear that from someone who was standing there. Clara looked at her for a long moment. You know this could complicate things for you, Clara said, depending on how the board handles Hayes' filing. I know. Kim held her gaze. I don't care. You told me the truth holds. I'm testing the theory. Something in Clara's chest tightened and released in the same motion. She thought about a 26-year-old woman who had cried in the bathroom the day before and was now standing in a corridor on her day off, having decided to be the kind of person who stands inside the truth, regardless of the cost. She thought about what that decision looked like from the inside and what it cost, and how most people made it only when they had nothing to lose, and how Kim was making it with her whole career still in front of her. You're going to be a very good nurse, Clara said. Kim's face did something complicated. I learned something this week, she said. I want to keep learning it. You will, Clara said. At 1:15 p.m. Sims called. The board rejected Hayes' attorney's filing, she said without preamble. Unanimously, the argument that Commander Voss's presence constituted coercion did not survive contact with the documentation record. Voss was present at the invitation of the hospital. His role was clearly advisory, and the review's outcome was based entirely on clinical evidence. A pause. The board also issued a formal statement confirming that your intervention on November 19th was consistent with appropriate standard of care, given your documented expertise and the clinical circumstances. That statement is in the hospital record. It's permanent. Clara was standing in the supply alcove, the same one where she had taken Voss's call 3 nights ago. Different call, same small space, the same fluorescent hum overhead. And Hayes, she asked. He's been asked to attend a formal meeting with the board next week. Not disciplinary at this point, but the pattern of behavior documented across the review processes is being addressed directly. He will have the opportunity to respond. Sims paused. He called me this morning, before the board session. He wanted me to know that he intended to withdraw the attorney's action. He withdrew it. He called his attorney at 7 a.m. His attorney had already filed. A beat. Hayes was not pleased. He spent about 40 minutes this morning doing what I think was the most uncomfortable thing he's done in his professional career, which was trying to stop a machine he had set in motion. Another pause. He couldn't stop it in time, but the fact that he tried that matters to me, and I think it should matter to you. Clara thought about the hallway yesterday. She did not hesitate, Hayes had said. 3 moments in 22 years. It does, she said. The credentialing framework goes to formal vote on Wednesday, Sims said. Chen is supporting it, Lawrence is presenting it, and Voss submitted a co-signature from Naval Special Warfare Command this morning, which I've been told is unprecedented for a civilian hospital credentialing action. She let that settle. Clara, I want you to hear what I'm about to say clearly, not as your administrator, as the person who has watched this week unfold from the inside. She paused. What is about to happen to your role here is not charity. It is not accommodation. It is correction. The institution making a correction it should have made before you walked in the door 4 months ago. You don't owe anyone gratitude for it. You earned it. The distinction matters. Clara closed her eyes for 1 second. The supply shelf was behind her, its contents lined up in the sensible order she had reorganized within her first week because the previous order hadn't made logistical sense. Thank you, Patricia, she said. First name. She had never used it before. A brief silence. Wednesday, Sims said. Be there. I'll be there. The afternoon ran long and full, and by 4 p.m. the entire ward had the feeling of a place that has been through something and is returning carefully to its ordinary self. Clara moved through her last 2 hours of the shift with the attention she always gave it, unhurried, methodical, thorough, and when the evening shift began to arrive, she completed her handover with the same even clarity she brought to everything. She was gathering her things at the nursing station when Hayes appeared. He had come from somewhere official, his coat was on, he was carrying his bag, and he stopped at the station with the expression of someone who has thought about what they want to say and has decided to say the shorter version because the longer version would take more than he currently has. I heard about the board decision, he said. So did I, she said. The attorney. That wasn't what I made that decision in a bad hour. He looked at the counter. And I tried to walk it back. I know, she said. He looked up. How do you do that? Do what? Already know. Already not forgive exactly. That's not the right word, but already have it filed somewhere that isn't anger. He shook his head slightly. I would still be angry. I've had practice, she said, with bigger things. He was quiet for a moment. Then Wednesday's vote on the credentialing framework. He looked at her directly. I'm submitting a letter of support to the board. Not because Chen asked me to, and not because Sims suggested it, because it's the right thing, and because my name on it carries weight in this institution, and that weight should be used for something useful. He paused. I haven't always used it usefully. Clara looked at him. The man in front of her was not the man who had pointed at her and said, "Step back," on the night of the 19th. He was not the man who had dismissed her in the conference room or built a legal case against the institution that had tried to protect her. He was a man who was doing the effortful, unglamorous work of being more honest than he had been, and that work was visible on his face, and she respected it in the way she respected things that cost something real. Your letter will matter, she said. He nodded. He picked up his bag. He was leaving. Then he stopped 1 step away and said something he was looking at the floor to say. The 2 patients I mentioned, the ones who died in the gap. He looked up. I haven't been able to stop thinking about what the gap looks like from their side, from the moment when someone knew what was wrong and couldn't act. He held her gaze. I'm going to think about that differently from now on. That's all Wood wanted to say. He left. Clara stood at the nursing station for a moment after he was gone. The station hummed with its ordinary sounds. The ward went about its work. Wednesday came in with the business-like energy of a day that has a clear function. Clara was in the conference room at 9 a.m. The voting panel included the full board 12 people, the most institutional weight the hospital could put in a room. Chen was there, Sims, Lawrence, who presented the credentialing framework with the precise documented confidence of someone who had been building this argument for 6 years and was finally delivering it to an audience that was ready to hear it. Voss attended by video from Naval Special Warfare Command in uniform, with 2 colleagues flanking him. Hayes's letter was read into the record by Gerald Holt, who delivered it with the careful neutrality of an administrator who understands that a letter like that is remarkable and is choosing to let the content speak rather than annotate it. The vote was 11-1. The one dissenting vote was a board member named Harrison, who had concerns about liability framework that were genuine and procedural and not personal, and who said so clearly and voted his conscience and shook Clara's hand afterward and told her the program was the right direction and that his vote was about the speed of implementation, not the substance of the initiative which Clara believed, because his handshake was the same as his vote, honest and without theater. 11-1. She stood in the corridor afterward with the formal certification paperwork in her hand and the noise of the hospital going on around her, the wheels and voices and overhead PA and mechanical hum of 10,000 small systems keeping people alive, and she felt the weight of the week settling, not dropping away, but settling the way a heavy thing settles when it finds its proper resting place. Janet found her first. 11-1, Janet said. 11-1, Clara confirmed. Janet looked at her for a moment. Is this what you wanted? When you came here, Clara thought about it. The honest answer, the real one, was no. She had come here wanting less, wanting smaller, wanting the manageable version, the quiet life, the daily work without the weight of being known. She had come here to disappear into usefulness, and the disappearing hadn't held. No, she said, but it's what was needed, and sometimes those two things end up in the same place. Mark was discharged on Thursday morning. She was there when Rodriguez brought the wheelchair. Mark insisted on walking. Rodriguez insisted on the chair. They compromised with the Mark sitting in the chair and holding his own bag on his lap with the expression of a man who had negotiated the terms of a tactical retreat. Commander Voss was in the corridor outside. Two members of Mark's unit were there as well in civilian clothes with the unmistakable bearing of people who are never entirely off duty. Clara was at the nursing station when he came past. He stopped the wheelchair beside her. I'm going to be back in 8 weeks for follow-up, he said. I'll be here, she said. The program documentation. The names. Voss confirmed it Thursday morning. It's in the record. She looked at him. Thank you for that. Yeah. He nodded once, looked at her with the direct, unhurried attention she had come to understand was just how he looked at people he considered worth looking at carefully. You're going to build something good here, he said. We'll see. No, he said. We won't see. You will. There's a difference. He stood up from the wheelchair. Rodriguez made a sound of protest that Mark overrode by the simple act of already being on his feet, and he straightened to his full height, and the two members of his unit behind Voss came to attention without being told, a reflex as natural as breathing. And Mark Carter looked at Clara Bennett in the corridor of the hospital where she had saved his life and where she was now formally and permanently exactly what she had always been. He nodded, not a casual nod, the kind of nod that means something between people who understand what it costs to stand up when staying down would have been easier. She nodded back. He walked out. She watched him go through the grass of the corridor until he turned a corner, and then she turned back to the nursing station, and she picked up the chart that was waiting for her, and she went to work. Later that evening after her shift, she sat in her car in the parking structure for a few minutes the way she sometimes did not because she was troubled. Not this time, but because the day had been large, and large days deserve a moment of acknowledgement before you drive away from them. She thought about a trauma bay in November, about a monitor alarm, about a man who had been dying and was now walking out of a building under his own power. She thought about Kim Reyes standing in a corridor on her day off, choosing to be the kind of person who stands inside the truth. She thought about Hayes saying, I haven't always used it usefully, and the cost visible in his face when he said it. She thought about Mark Carter, who had gotten himself out of a hospital bed and into a conference room because he had decided that a thing needed a witness. She thought about the 3 names that were now in the official record of a program that would send trained, authorized, fully recognized combat medics into hospitals across the country, not as floor nurses in roles too small for them, not as people waiting to be told they were allowed to act, but as exactly what they were. She started the car. Clara Bennett was not a woman who needed a story told about her. She had never needed the validation, never needed the applause, never needed anyone to understand what she carried or what it had cost or what she had been before she walked through a set of hospital doors 4 months ago looking for something smaller than herself. But the truth had been said, and the record had been corrected, and the institution had been changed, and a man was alive who would not have been. And the names of 3 people who deserved to be remembered were now written somewhere permanent. That was enough. That had always been enough. She drove home through the November dark, steady and unhurried, exactly as she had always been. Not because no one was watching, but because that was simply who she was, and who she was had never needed anyone's permission to matter.